The 2015 timeline set by the United Nations for the achievement of the 8 Millennium Development Goals is upon us. On this episode of Rivers of Possibilities, we'll take a look at River State's effort at achieving the health MDGs. I'm Onyi Sunday, and you're watching Rivers of Possibilities. The health sector remains the most critical amongst the Millennium Development Goals. Reducing child mortality, improving maternal health, combating HIV, AIDS, malaria and other diseases make up Goals 4, 5 and 6 of the Millennium Development Goals respectively. Over 14 years, some level of success have been recorded in various countries on the achievement of some of these goals. According to the World Health Organization, globally, the number of deaths of children under 5 years of age fell from 12.6 million in 1990 to 6.6 million in 2012. In developing countries, the percentage of underweight children under 5 years old dropped from 25% in 1990 to 15% in 2012. In Nigeria, according to the National Bureau of Statistics, infant mortality rate dropped from 100 per 1,000 live births in 2004 to 58 per 1,000 live births in 2014. Under 5 mortality dropped from 201 per 1,000 live births in 2004 to 89 per 1,000 live births in 2014. While the country has recorded a remarkable reduction in the number of deaths, achievements vary from state to state. River State is one of the states that have recorded some level of success in Nigeria. The spread of functional primary healthcare facilities spread across the state have been identified as a leading factor behind the gains recorded.
70% of our disease burden around here, probably 80, can be tackled at the primary healthcare level and the rural levels. So looking at it, we decided to tackle healthcare from that perspective. We didn't quickly just look out to say, oh, there are things like MDG goals. What do we do about it? But we went simple about it, the basic about it, because there were no indices to even relate to. However, we went in like that and went into a primary healthcare program, developing infrastructure, at the same time going out to reach the people. We did a lot of rural outreach personally, sometimes the governor himself and other officers in the ministry. A lot of rural outreach for them to buy into our new program of primary health care, a new program that takes health care to the people and have them relate properly with what we are doing.
Primary care is where to start when you talk health. And the national government had at some point decided that they actually needed to go that way. And so the National Primary Healthcare Development Agency was set up. And in order to reach everywhere, there was a need to set up state primary healthcare development boards, which was why we were set up, with intent to not only meet the MDGs, but to render primary care at whatever level it's meant to be rendered. And since we've been on board, we've actually been working with the minimum package of care, which is the list you have to provide to actually serve primary care. And the minimum package of care addresses all that MDG 4, 5, and 6 have. Basically, we have come away from where we were in 2011 when we started with all activities of primary care. And we've come to a level where the last national assessments placed us at over 80% achievement of primary care. With respect to the MDGs. The Primary Healthcare Board, for the first time in Rivers State, was able to attain the administrative coverage for immunization of 100%. And so, we were also adjudged to have been able to set up a proper funding structure for primary healthcare system, which means it is sustainable. Whatever we're doing now is sustainable because of the structure that is in place.
Diarrhea, malaria, and pneumonia remain major causes of deaths amongst infants in River State. But with the current mortality rate of under 5s at 91 in every 1,000 live births, the government believes its 100% immunization coverage is responsible for the reduction.
So once you have a good immunization coverage, you find that you don't get those outbreaks. Usually at the beginning of every dry season, there's an outbreak of measles, But we haven't had it since we had that full coverage. We haven't had those outbreaks. So immunization is so important. If you're able to achieve that alone, you cut infant morbidity and childhood mortality by more than half. And so that's why there's a lot of focus for us on getting good immunization coverage. As you know, Nigeria is trying to get a full eradication of poliomyelitis. We haven't had any for 3 years in Rivers State, and by God's grace, we intend to keep it that way. And it's only achieved by immunization. So all those childhood diseases that I mentioned, the place we still have the serious problem is with diarrhea. The 3 outbreaks we've had since last year have been diarrhea diseases, and it's mainly because of the source of water supply.
Sizable communities still exist throughout Nigeria with no access to clean water supply. Rivers State is tackling its problem through the state's commercially run water corporation.
And so we looked at the sector and we decided, okay, we need to really change the approach to the way water infrastructure is even being developed in the local government areas. We also looked at the institutional side and the governance side, and those are the issues that still remain there. They're just the same issues in the urban sector. It's the same issues we face in small towns or rural water supply. And so in our water policy and laws, we now created new institutions that could focus better and engage the local governments in a more sustainable manner in the way we're handling water supply in the local government level. So we also have set up an agency called the River State Small Towns Water Supply and Sanitation Agency and the River State Rural Water Sanitation Agency, which is supposed to handle small towns and also for rural water supply for isolated communities.
The location of most communities and settlements scattered across rural areas presents a logistical challenge to development. To address this, the State Water Corporation has clustered most of these communities in Rivers State into zones.
Instead of isolated small schemes, we want regional schemes that will take care of several communities where they're closely located, so we're able to manage with operations and maintenance. We're currently working on the cost recovery mechanisms that are required because people have to pay for water.
The distribution of public health workers in the communities has also led to a drop in the mortality rate of children under 5. The primary healthcare centers serve as a base for public and community health workers to carry out sensitization campaigns on hygiene.
Simple health education. Health education on water. Health education on breastfeeding. Health education and common hygiene practices, and all that can be gotten from the primary healthcare centers, will save a community.
Now, it's usually very difficult to measure maternal mortality in our environment. I'll tell you a few reasons. First of all, in recent times, not more than 10 years now, our mothers have taken to going to have their babies in churches. And if anything happens there, you will not know. It will not come into our record. And because they come for antenatal in the primary health centers, they take the antenatal, course through all the way to the time of delivery, and they do not come back to the health center to have their babies. So when those deaths, those maternal deaths do occur, we don't have a record of it. So that's why we don't say that we can have an accurate record of maternal mortality in the state.
Although Medicare is free for expectant mothers and children under 5 in Rivers State, pregnant women continue to visit religious medical centers instead, often with lethal consequences.
That is the ignorance of somebody with a transverse line going to push in a TBA, that is a traditional birth attendance place. The ignorance of thinking that operative delivery is from hell and it must not be done. Say a woman with an abnormal lie, abnormal placenta, and placenta previa will want to push and bleed. Hemorrhages. So by and large, ignorance and poverty contributed a lot to to maternal mortality.
Religious houses and traditional birth attendants are popular all over the South-South region of Nigeria. Nigeria's federal government is yet to take a strong stance against such religious houses.
I think we are living in the season when there is so much poverty, and it's so easy now to brainwash people to think that every health challenge is caused by one witch, one devil or something. And because of the belief system, there's a cycle of poverty and disease. If you're poor, you'll be sick because you'll be malnourished and you won't be able to afford the treatment. And that now is being exploited, to psych up people as though the entire solution to their problem is spiritual. Physical things are now made to sound like they're spiritual challenges. And because people now go along with that, they believe that all the solutions to their problem lie in the church. And so when they come for antenatal and you try to teach them diet and all of those things, they still end up where the pastor has told them that if either you come and deliver here or the witch that has been chasing you will cause you to die at the point of delivery. So it has a lot to do with the environment, the poverty in the land, and the fact of exploitation by those who manage them in the spiritual sense. I did hear the Commissioner of Health say, not more than, not just once, several times, that he is going to go after these churches who do not have the license to practice medicine within the confines of their premises. I can't give details about how he's approaching that, but I believe that he's doing something about it. I'm sure we'll see results sooner than later.
In Rivers State, maternal mortality currently stands at 400 in every 100,000 live births. Eliminating HIV, AIDS and malaria are one of the main goals of the MDGs and a major cause of infant and under 5 mortality. With a national average prevalence rate of 3.5% in 2014, Rivers State has made some progress with a prevalence rate of just over 1%. The Executive Secretary of the Rivers State Primary Healthcare Management Board attributes this to the increase in the number of prevention of mother-to-child transmission centers.
Before this board came on board, in Rivers State we had about 3 treatment centers, for the patients who were diagnosed. And in any case, most people also needed to go to a hospital to be diagnosed. But with the advent of the health centers and the fact that we now have HCT centers, that is places where people can go and do their tests, we have also gone beyond that. In the last 2 years, we have upgraded a number of our facilities to be PMTCT centers. That is where they now handle pregnant women who have HIV and AIDS to the time of delivery and do all that is needful to protect the child from getting the HIV. And we also now have a few treatment centers. Some of our health centers, the doctors are being trained to now begin to give treatment. So people don't have to travel miles to just those 3 earlier existing treatment centers. So the existence of the PAC system has actually contributed immensely to expand access to HIV services in the state in terms of both diagnosis, treatment and control.
Efforts to eliminate HIV, AIDS continue in the state through sensitization campaigns at the primary healthcare centers and through community health workers charged with the responsibility of educating their immediate communities of the disease.
Over 800 Nigerians lose their lives to malaria every day. In fact, most Nigerians describe their environment as malaria endemic. Well, after the break, we'll take a look at how a tropic region like Rivers State is tackling this killer disease and find out how well positioned is the state's health sector in achieving the health-related goals of the MDGs. Do stay with us. Welcome back. If you're just joining us, you're watching Rivers of Possibilities, and the focus is on achieving the health-related goals of the MDGs in Rivers State.
Malaria remains a major killer disease of both mother and child in Nigeria. While the campaign to prevent malaria is ongoing across Nigeria, Rivers State has embarked on a mission to eradicate it from the state. Dr. Kalada Eruenabere is the coordinator of the state's biolarviciding project, a major part of the state's malaria elimination program.
We had an opportunity to be part of an entourage to Cuba, and there we were told about biolarviciding, because in Cuba they don't have they have mosquitoes, but very sparing. They don't have malaria. In fact, if they see a case of malaria, it's a serious notifiable disease. It's like the way they will take a case of malaria in Cuba is like another Mr. Sawyer had come into Nigeria. You understand? So we asked them what was the secret, and they told us that they eliminated malaria by attacking the larvae of mosquitoes. Immediately went into sign 2 contracts. One of the procurement and application of biolarvicides. Our results were remarkable, very, very remarkable, both in the mosquito population and the outcome in the malaria reduction.
The biolarvicides are made up of 2 bacteria that cause the mosquito larva to explode. The biolarvicides have been applied in 10 local government areas in the state, including open containers storing water for domestic use. According to the project coordinator, the biolarvicide is not harmful to humans.
I know the good thing also is that it wasn't specific on a specific mosquito. So it took care of both Anopheles, which is the major culprit in malaria. It took care of Culex, took care of Aedes. I know these are the mosquitoes that spread filariasis, spread what they call yellow fever, and in some places chikungunya. So with one bolt, where our aim was to go after malaria, but we are looking after yellow fever, we are looking after filariasis, and also, which is this other disease, dengue fever. So it was a very great thing that we learned.
Plans are currently underway to build a biolarvicide manufacturing company in the state and increase the application of biolarvicides to more communities in Rivers State. With technical support from Cuba, financial support from Venezuela, and the backing of ECOWAS, biolarvicide factories are to be constructed in Ghana, Abidjan, and Côte d'Ivoire. To further address the health-related goals of the MDGs in Rivers State, the state's health sector had to undergo some healing of its own. Having only a handful of functioning primary healthcare centers in 2008, Rivers State now owns over 200 primary healthcare centers and over 100 functioning model primary healthcare centers.
We have a proper primary healthcare board set up. The primary healthcare board has also established, through the primary health centers, the implementation of the minimum package of care. The primary healthcare board, for the first time in Rivers State, was able to attain the administrative coverage for immunization of 100%. And so, we were also adjudged to have been able to set up a proper funding structure for primary healthcare system, which means it is sustainable. Whatever we're doing now is sustainable because of the structure that is in place.
The state, however, realizes that curbing maternal and child mortality goes beyond the provision of facilities. A large number of women who attend antenatal classes in the past do not return to the hospitals to have their babies. This was attributed to the lack of health workers across primary healthcare facilities in the state. The state is addressing this through the training of health workers. Here at the College of Midwifery, midwives are being trained in their numbers to take up employment in the existing and new primary and secondary care facilities in and around the state.
Again, the community health extension workers, we're supposed to have them in good number in each of the facilities. We do not have that. And it's a problem, in terms of carrying out some of the activities, particularly the home-based care program. We have a program we introduced in the States. It's the only state that's running it in the country, the home-based care, where the community health extension workers carry the health service to the homes of the people. And for you to do that effectively, you need a lot of community health extension workers. We do not have the number that we require. And those categories of staff are usually recruited by the local government councils. And yes, and they haven't been too willing to do that. So that's where we have the serious challenge. We don't have enough nurses.
At the School of Nursing and Public Health, these public health care workers are undergoing training. Most of these medical personnel, however, may not make it to the primary healthcare centers. Owing to dwindling funds from the federal allocation, the local government councils charged with hiring and paying the workers are most times unable to pay their staff. To address emergencies that may arise owing to understaffing and strikes, the River State government has established hospitals run by the state and private sector. They are usually not affected by industrial actions which are rampant in Nigeria's health sector, therefore catering to mothers and infants from far and near free of charge. Fully equipped, these hospitals cater to a range of medical cases round the clock. Situated in the towns, mobile clinics and ambulances stand by to bring patients to these secondary health facilities.
Since we now have a cluster of hospitals scattered around the place, we now use the hospitals for our own local bases. So the ambulances are scattered and warehoused in various health centers. Now, how it works is very simple. We get the calls either through the state emergency number, the 112, or they call us direct, 080-3310-4730. That's our own direct line. So we get the calls from any of them, or from any of the hospitals or health centers. And using the radio, we activate, they go, and they bring the persons to either here or Kelsey Harrison. Basically, that's how they operate.
Easy access to Medicare is encouraged further with the presence of this company, the integrated medical industry in River State. The company manufactures essential medical supplies used in hospitals in and around River State. Amenya Wokoma is the Chief Executive Officer of the state and private sector-run company.
The case for local production is very compelling, not for many reasons. Again, if we go to standard or substandard, in our industry we always use those words because anything that is below standard is dangerous. So it is either good enough or it's not good at all. We shouldn't use drugs that are maybe standard. No, there's no such thing. And for the products we are targeting, most of the ones that are currently available in Nigeria are substandard. So it's bad. It's not whether we like it or not, or whether you like a particular brand or not. They are bad, they are bad. So, and that's why we have this kind of big capacity. So if we are producing standard products, we should produce enough for the whole of Nigeria. Not that some people, all the people in River State only will have standard syringes and then the people in Imo State, well, they're on their own. No, it's for the whole of Nigeria and spilling over into West and Central Africa.
The River State government currently owns 70% of the company. Plans are underway to divest the company to the private sector. Currently manufacturing syringes for immunization, 4 factories are currently under construction to manufacture IV solutions, syringes and hypodermic needles when completed. With the 2015 deadline closer than ever, projects like this and the current health policies in the state's health sector, if continued, could lead to a further decline in the number of child and maternal deaths and a reduction in malaria, HIV and AIDS-related cases in River State.
First of all, healthcare must be accessible to it. If you want to achieve the MDGs, they must be accessible. They must be available first, then accessible, then affordable. Without this, there is no way to get to the MDG goals of reduction of infant mortality, maternal mortality, reduction of malaria, HIV, AIDS, and education, particularly health education, very important to hit the MDG goals. This is the fulcrum. This is the focus. If we want to do something in this country and we are serious about the MDGs, we must begin to redevelop and reassess our primary health care delivery services. But if you ask me, have we reached the mark? No. But we are far away from where we started. A little more effort, a little more commitment, a little more indulgence and patience, we can actually hit the mark.
With less than 300 days to the Millennium Development Goals deadline, a call for a further push by all to achieve these health-related goals reverberates now more than ever. I'm Onyi Sunday. Thanks for watching.